How to answer this question, like in a tough case where the prognosis is not looking good, and the patient side, the caretakers ask like, how fast can it be cured, or how much time treatment is required. How to answer that question when the answers are really tough? So what is the language to speak?
Usually, even I do get such questions, and very typically I answer them. Have you asked this question to your previous doctor? If they say yes, then what was his answer? If they say no, we can't because he's allopathic doctor, we didn't ask all these things, then why are you asking all these things to me? I am also here to treat your condition. I can explain what your condition is and what would be the outcome of treatment. I am not a god to give you some damn assurances. That cannot be done. Ayurveda very clearly, Charaka Acharya has very said, don't give assurances while treating the Vata Vikaras. So in the similar thing, that's only one indication he has spoken about. We need to carry that information to all the places. We don't want to give any guaranteed chikitsa. It's not doing that one. We are doing a proper understanding of a disease, and we are giving a treatment protocol, and we are trying to manage the condition, or trying to cure the condition, or even trying to avoid the further deterioration of the condition. So when we are using such terminologies and that methodologies, then definitely the patient side will be convinced. And once they are convinced, when they still they have a doubt, better you go with some legal documentation, write down the things, what are the things you explain to them, what could be the probable outcome of your treatment, everything, pros and cons, and even the prognosis of the disease, everything you explain to them. Then if they are ready, then take a signature, then further you start a treatment, then things will be in line.
Yeah, I mean, being on the right side of the legal aspects is covering our sides is very important there. Can we say that, do you ever venture into giving like, we can expect this much percentage of benefits? Do you try to value, or do you try to forecast in terms of percentage of healing? Do you ever say that?
Yeah, that can be done. That can be done. Many times I used to also say that, see, I can bring down your problems by 70%. So that type of commitment is good. That can be done. Usually, even many times I say that I won't even for all the hepatitis conditions and the cirrhotic ascitic conditions, when they come to me, I'll say, if you take my treatment and if you leave for 1 year, definitely will completely reverse your problem, because leaving 1 year with this condition itself is a big task. Medicine part and all these things are secondary. You have already gone down to such a level, you are in a very slippery area, you are pulling you up is very difficult, and I'm trying to do that. And if God supports, definitely the things will be in a right direction. So for that, I say, usually, if you could able to take these medicines for a particular period, then things will be in line. Then definitely I can assure you 70% to 80% I can make you a normal person. But if you are still alive up to 1 year with this medication, definitely then the things will be reversed totally. So I can assure you only in those areas where clear assurance can be given, where we have a confidence and such type of things are there. Where there is a problem, where you feel that the mentality of the patients or their relatives is something like they're doubtful, and they're even questioning the authenticity of Ayurveda and something like that, better to go in a legal manner, write down the things and get a signature consent form signed by them, and then later start the treatment.
And another approach can be like month by month. Say, let's analyze month by month. Based on your progress, we can forecast better how your body adjusts to the given medicine and given treatment. Based on that, over a period of time, things can improve, but nothing can be promised. It cannot.
Yeah, no, that's the right way of doing things. That's what usually even I do. Whenever I give a medicines, usually in the first time when the patient comes to me, a new patient, usually not more than 15 days medicine I will give. Usually that is my practice methodology. I ask them to come with 15 days time. 15 days time, I will come to know at least whether the drug has started working or not, and even the patient will also feel certain initial benefits, so that can be assessed very easily. So that's the reason we can also take that chance and saying that, see, one can do one thing, that it is better you take a medicine for 15 days, you come back with 15 days, then you can tell me what's your progress, then accordingly we will fine tune the treatment protocol, then accordingly we can select the better drugs, or even improvement or anything to be added, or any investigation has to be done. Let us do that and then finalize what can be done. So it's
Yeah,
initially only for 15
that
days
that looks,
treatment.
yeah, and that looks like an excellent strategy. Another advantage with such a kind of approach is that in the first round of patient interrogation, it's very hard to assess all the prakriti and all the agni and the srotas and all the things and coming up with a plan. But the first initial few weeks of treatment with the medicines, how they react, based on that also gives a lot of information regarding their sattva, their mental strength, their agni level, and all those things. So,
Not only that, I have a different set of problems in my practice. It is initially problem with the bitter principles of drug which I give in the form of kashayas. How could they can take that bitter principle kashayas for a longer duration? Because these people, the young generation, they will be always be exposed to a modern medicine, and they're in the form of syrups and sweet somewhat, something like that, and they never come across such a bitter principles or bitter medicines of Ayurveda. So when I have given such medicines, let them take first, then they'll come back. Then definitely they have developed a very good resistance to the taste, and that's what the initial benefit. And definitely then they'll follow my instructions.